How you doing today?
I'm fine.
Okay, let me clean my hands. My name is Miriam. I'm a nurse practitioner student. Please, can you tell me your name, date of birth, and why you're here?
My name is Fred. 1 September, I'm here for a regular checkup.
Okay, thanks. I'm happy to hear that. So, today I'm going to do an assessment on you. Before that, do you have any pain right now?
No.
Okay. You feeling okay?
Yes.
Okay, so I'm going to inspect. The patient is alert and oriented. He knows where he is, why he's here. The skin looks good. No signs of respiratory distress noted. And is well dressed for this exam. So next I'm going to start from your back, which is posterior lungs. I will have you turn that way. So first I'm going to inspect the interior wall for symmetry and shoulder muscles. I'm going to look at the skin. The skin, no issues with the skin. Check for chest movement is symmetrical in inspiration and expiration. Okay. So first I'm going to test for tactile parameters. Okay. So I'll have you. So when I put my hands on your back, I would like you to say 99, 99. Okay.
Okay.
Okay. It's gonna be a little cold. Okay.
99, 99, 99, 99, 99.
Okay. So I felt the vibration on both sides. Next, I'm going to test for chest thoracic expansion. Okay. So I'm going to touch your body again. I would like you to inhale and exhale for me. Okay.
Okay.
Okay. Okay, so chest wall expansion is symmetrical because my thumbs were moving both bilateral on both sides. So next I'm going to do percussion. Okay. Okay, so I found the normal finding. I felt resonance throughout the lung on posterior lateral lobes. Okay, so next I'm going to auscultate the lungs. Breathe in and out for me as I put my stethoscope.
Okay.
Okay, so the lungs sound are clear both. No adventitious sound heard in or ropes. So next I'm going to have you turn towards me so that I can assess your anterior chest
Okay.
lungs. Okay. First, I'm going to inspect. I'm looking for an abnormal breathing and parallel chest and picture chest, and it looks symmetrical. No signs of deformity is noted. Okay, so we're going to auscultate for your lungs, and I don't see any accessory muscles or any deformity. So I'll have you breathe in and out as I place my stethoscope.
Okay.
You okay?
Yeah, I'm okay.
Breathe in and so your lung sound is clear to bilateral, low and up and lower lobes. No wheezes or no mama's heart on that. So next I'm going to inspect your heart. I'm going to listen for your heart, but I'll let you lay down. Which side do you want to turn, to this side or that side?
Let's see. Maybe this side. No. This side.
Okay, so I'm gonna move this way.
Okay.
So before that, I'm going to palpate for your carotid artery. Okay? First, I'm going to auscultate and then palpate. Okay? Can you hyperextend your neck for me? Are you okay?
Yeah.
Okay. I'm going to use the bell actually. I'm auscultating for the fluid. I'm going to listen to the other side. Okay, so next I'm going to palpate. I'm going to palpate one side at a time. Okay, I can feel the fluid is strong. Strong at this side as well. So next I'm going to listen for your heart sound. You can move the pillow. Okay. So I'm going to listen for, I'm going to inspect your chest for, I'm going to inspect for the lifts, for the halves, and for trails, okay? So I'm inspecting and I'm going to palpate, okay? Feel the air up. Okay. So next I'm going to auscultate for 5 locations, and I'm going to use the diaphragm and then use the bell as well. So the diaphragm is we hear the strong and louder sound, and the bells we hear like kind of soft and lower sound. Okay. So first I'm going to do the landmark of the heart. So okay, so this is right. Okay, so this is left. So I'm going to start from the right second intercostal space. and then I oscillated the left second intercostal space, and next I'm going to listen at the eps, which is at the third left intercostal space. Next I'm going to auscultate for tricuspid. It's on the fourth and the fifth intercostal space down right here, and finally I'm going to auscultate for the mitral, which is at the apex of the eye. Okay, so I'm going to start using the diaphragm first. So I'm going to start from right second intercostal space. I'm going to second left intercostal space right here. Next I'm going to auscultate for the ups, which is at that left intercostal space right here. I'm going to auscultate tricuspid, which is on the fourth and fifth intercostal space, just down here. And this mitral at the apex of the heart. Okay, I can hear the sound. It's normal. I do not hear any murmurs. It's strong and they are audible. Okay, so next I'm going to auscultate using my bell, the same pattern that I went. I'm going to start the right second intercostal space, second left intercostal space, going to listen at the apps, which is on the third left intercostal space, tricuspid, the fourth and fifth intercostal space, and then mitral at the apex of the heart. Okay. So on the bell side, the sound is less, but it's audible. No murmurs, no trill that was heard. Okay. So next, I'm going to move down to the abdomen. Okay. So I'm going to inspect first. The abdomen is slightly rounded, no mass, no skin discoloration, no dents. So first I'm going to auscultate for the power sound, and then I do the percussion, and then I do the touch, which is right touch and hard touch. Okay, so I'm going to start from left or right lower low quadrant, and to upper right quadrant, going to do left upper quadrant. And I'm going to listen for the left lower quadrant. Okay, so next I'm going to percuss. Okay, is it okay?
Yeah.
Okay, so next I'm going to right touch palpation, and then I will do deeper right palpation. Okay, you just let me know if you feel any pain or tenderness just along the way. Okay,
Okay.
I'm going to start with the right touch. No masses, hot. Okay, I do not feel any masses or anything. Okay, next I'm going to do the hard, like hard touch. Again, let me know if you feel any tenderness or any pain.
Okay.
Okay. Okay. No masses felt. Okay, so I did not feel any masses, or patient did not complain of tenderness or pain. So next thing I'm going to auscultate for the, I'm going to do the aortic, iliac, renal, and femoral artery. I'm going to auscultate, okay?
Okay.
So I'm going to auscultate for the aortic artery, which is down here around the epic history. I'm going to listen for the trills or uproots. Okay. So next I'm going to auscultate the renal on both sides. There no should be. I'm going to listen for entrails. The right side, and I'm going to listen at the left side. Okay, next I'm going to listen for iliac artery. I'm going to do both sides. Should be down here. It's artery heart. Next, I'm going to auscultate for the femoral artery. I'm going to do it on both sides as well. Okay. Listen on this side there. Okay, I can feel this palpable and strong. Okay, so next I'm going to auscultate auscultate and palpate for the liver and then the spleen. So the liver is on the on the right side, and then the spleen I'm going to palpate on the left side. So since I'm here, I'm going to start from the liver, and then move around and palpate the spring. Okay, I'm going to put one on my hand so that you can lace it up. No, you're fine. You're okay. I'm just gonna put my hand. Okay, so there it is. Okay, so I'm going. Let me know if you feel any tenderness or pain along the way. Okay. So, I can feel the edge of the ribbon is smooth and palpable. Okay, so next I'm going to palpate for the spring. I have to turn this way. That's fine. So I'm going to put my hands. The spring is on the left side. Don't know if they're gonna be able to. Okay.
I can turn around.
Okay, let me try to. I'm gonna just lace this up and try to. They can't really turn around. Okay. So I'm gonna come this way to palpate for the spring. Okay. I'm gonna put one on my hand, trace it up so that I can be able. That's fine. Okay. I can feel the springs, right? All right. Okay. All right. So next, I'm going to have you. You can sit up. So I'm going to palpate for the CP on I'm going to feel your yeah, your kidneys. I'm going to palpate for the CP, which is costal febrile artery. I'm going to just tell me when I touch if you feel any tenderness or pain. Okay, I'm going just down here. Just there. Okay, and I'm going to kind of percuss to speed the down sound. Did you feel any pain? Okay. Going to tell me if you. Okay. So next, I'm going to check for the artery. I would like you to see. I mean, not artery. I'm going to assess for the pulses. Okay. So first, I'm going to check on the radio. I'm going to inspect first and then feel the radio pulse on upper extremity, which is the hand, which is I'm going to palpate for the for the radio and the brachial, and on your lower extremity I'm going to palpate for posterior tibia and dorsalis pedis. Okay. So I'm inspecting first. That's fine. Make that. So I'm going to palpate both head at the same time. Okay. I'm going to start from the radio pulse. I can feel them very strong, and it's +2. So next I'm going to check for the brachial pulse. Okay. So I'll have you do like this. I'm gonna move this way so that So I'm gonna feel it. I'm gonna put my hand here. So can feel it's strong and it's plus 2. I'm gonna do the other side as well. I'm gonna have you look that. Okay. Okay. Now I can feel it. It's strong and it's 2 plus. Okay. So next I'm going to check your pillow. Maybe you can this way or that way.
I think like this way.
That's fine. So I'm going to inspect. Okay. And so I'm going to start from posterior tip here. Posterior tip is right here. You can see. Okay. Kind of sluggish. It's plus 1 on this side. I'm gonna check on this side and on this leg as well. This one is strong, plus 2. So next I'm going to check the dorsarius digits. You can put your legs put if you can. So I'm going to fix both leg at the same time because I can be able to do this one is. So I'm going to, this is dorsarius. I'm going to feel what. Yeah, both are palpable, strong, and plus 2. So next I'm going to check for edema on the lower extremity. I'm going to palpate on the ankle side, the radial side. No edema on that leg. I'm going to just press for. There's no edema noted on lower extremity. So that concludes the end of our exam today, and thank you for your cooperation, and I will see you next time.
Thank you.
You for your time.
Thank you.
Okay.